Your blood sugar silently continues to function each night as your body sleeps, occasionally rising, occasionally decreasing. Additionally, for diabetics, that nocturnal roller coaster can cause sleep disturbances, silently increase morning blood sugar, and over time harm kidneys, nerves, and even the heart. But what if this maelstrom could be subdued with just one calming drink before bed? This video reveals 3 potent nighttime beverages that can enhance insulin sensitivity, promote deep, peaceful sleep, and subtly drop blood sugar. Stay with us if you're sick of battling recalcitrant blood sugar levels or waking up exhausted. Your evenings will soon be different. Let's begin with the first, tea with chamomile. Although chamomile tea can seem like a straightforward herbal beverage, it can be a nocturnal boon for a diabetic's complete body. There are more uses for this mild flower infusion than merely helping you go asleep. It protects blood vessels, relaxes nerves, and stabilizes blood sugar. Its benefits are subtle but significant, particularly for people who have diabetic nerve pain, blood sugar surges, or restless sleep. Chamomile is unique not only because it soothes the mind, but also because of the bioactive chemicals that are concealed within each blossom and function quietly as you sleep. Additionally, this natural tea provides a profoundly nourishing role without unpleasant side effects for seniors whose bodies are more susceptible to stress and sugar changes. Apigenin, a potent antioxidant flavonoid that lowers inflammation and promotes insulin function, is one of the main ingredients in chamomile. It binds to brain receptors that promote deeper, longer sleep by calming the nervous system, which directly enhances glucose metabolism during the night. One of the hidden causes of diabetics' early morning blood sugar rises is high cortisol levels, which are frequently brought on by inadequate sleep. Chamomile helps lessen the chance of these increases by boosting the production of melatonin and gradually lowering cortisol. This tea serves as a natural regulator for diabetics who have trouble sleeping during the night due to worry, hot flashes, or frequent urination. Frequent use at night has even been linked to improvements in HbA1c, which lowers the chance of difficulties in the long run. Additionally, chamomile promotes nerve health, which is critical for diabetics who experience tingling, numbness, or neuropathy. Its ingredients reduce oxidative stress, which can harm the tiny blood vessels that supply the nerves and soothe hyperactive nerve signals. Quercetin, another antioxidant included in it, shields sensitive nerve endings and lowers low-grade inflammation, which frequently hastens the degradation of nerves. Even minor calming effects can enhance circulation, lessen pain perception, and improve sleep quality in persons with peripheral neuropathy overnight. From a nutritional perspective, chamomile is perfect for a diabetic-friendly evening beverage because it is naturally free of calories, sugar, and caffeine. Although it lacks several macronutrients, it does contain modest but healthy levels of potassium, calcium, and magnesium, all of which are important for heart rhythm stability, muscle relaxation, and nerve transmission. These minerals assist hydration, which is frequently neglected in diabetes care, aid lower leg cramps, and enhance blood pressure regulation. Additionally, chamomile's polyphenols protect the retina by lowering oxidative stress, which is a contributing factor to diabetic retinopathy and vision loss. By reducing internal inflammation and reducing the strain on blood vessels inside the renal system, these same antioxidants protect the kidneys. Chamomile tea gently supports the gastrointestinal tract in diabetics who are prone to digestive problems such as bloating, acid reflux, or poor stomach emptying. It eases intestinal smooth muscle tension, which lessens cramping and facilitates better absorption of nutrients, particularly at night when digestion naturally slows down. A healthy, balanced digestive tract promotes improved insulin sensitivity by lowering intestinal inflammation. Glucose regulation and gut health are closely related, and chamomile can help create a more robust microbiota without the need for fiber pills or supplements. To optimize these benefits, chamomile tea must be prepared correctly. To avoid minerals that irritate the kidneys, especially in people with minor renal difficulties, always start with filtered or purified water. Heat the water until it begins to gently boil. Take off the heat and add 1 organic tea bag or a teaspoon of dried chamomile flowers. Put a lid on the cup and steep it for 5 to 7 minutes. Because it retains the volatile oils that provide the therapeutic effects, covering is crucial. Steeping for longer than 10 minutes can release bitter compounds that can irritate sensitive people's stomach lining. Steer clear of typical blunders that might negate its benefits for diabetics, such as adding sugar, honey, or artificial sweeteners. Insulin surges at night can be caused by even tiny amounts of additional sugar. Use a little piece of cinnamon stick or a few fennel seeds, which are naturally glucose-friendly, if you like more flavor. Chamomile is most effective when consumed 30 to 45 minutes prior to bedtime. This allows your body to smoothly transition into sleep by absorbing its calming chemicals. If you have nocturia, you should avoid drinking it right before bed, because even a tiny cup can make you feel the need to urinate more during the night. 1 cup per night is the recommended dosage. Some people may experience nausea, drowsiness, or stomach distress if they consume excessive amounts, particularly more than 2 big mugs. Chamomile may cause a moderate allergic reaction, such as skin itching or nasal congestion, in people who are allergic to ragweed, daisies, or marigolds. It's important to keep in mind that chamomile may intensify the effects of sedatives and interact with blood thinners like aspirin or warfarin. Therefore, if you are on long-term medication, always consult your doctor. When beginning chamomile, diabetics using insulin or sulfonylureas should keep a close eye on their blood sugar levels because the herb can subtly increase the action of insulin, which can cause hypoglycemia if dosages aren't changed. Additionally, chamomile tea helps older persons with diabetes and hypertension by lowering blood vessel wall tension, which supports the cardiovascular system in a gentle way. This is a pleasant dual advantage. Overnight, the natural desiccation action enhances oxygen flow to tissues, promoting glucose metabolism, mending, and nerve recovery. It might even lessen arterial inflammation, which would minimize the long-term risk of atherosclerosis, a typical consequence of poorly controlled diabetes. Soaked cinnamon water is your go-to midnight ally if chamomile tea soothes you like a soft lullaby. It is more than a spice. While you sleep, nature's silent glucose warden is at work. Are you curious about how a basic stick can help you manage your blood sugar? Let's explore this effective nighttime cure. Soaked cinnamon water comes in second. It's not merely a nightly habit to drink soaked cinnamon water. It can be a silent warrior for diabetics, lowering blood sugar, calming the body, and promoting long-term repair all through the night. This drink may appear straightforward, but when taken as directed, it uses potent plant-based chemicals that lower insulin resistance, protect the most susceptible organs in diabetes, and gently regulate blood sugar. However, in order to fully realize its potential, you must comprehend the science underlying it, learn safe preparation techniques, and steer clear of frequent blunders that could backfire. Let's go over it one step at a time. Something worthwhile is working in your favor with each drop. Cinnamaldehyde, the primary ingredient in cinnamon, does more than merely give it a cozy scent. It enhances your cell's sensitivity to insulin, particularly if you have type 2 diabetes. This implies that less insulin is required by your body to transport glucose from the bloodstream into the cells. Soaked cinnamon water may thereby encourage lower A1C levels, lessen the strain on the pancreas, and lower fasting blood sugar. This is especially important at night, When natural hormonal fluctuations cause diabetics to frequently have unstable blood sugar levels. Amazingly, cinnamon slows down the stomach's emptying, preventing blood sugar increases even hours after meals. For diabetics, particularly those who have morning highs, this effect is crucial. By regulating blood sugar levels overnight and promoting insulin action while you sleep, drinking soaking cinnamon water before bed may help lessen such increases. Moreover, it possesses inherent antimicrobial, anti-inflammatory, and antioxidant properties. All of these are essential for the diabetic body, which is continuously fighting oxidative stress and low-grade inflammation. Despite lacking conventional vitamins, cinnamon contains active chemicals that function similarly to gentle medicine. Manganese, iron, calcium, and fiber are all present in trace levels in a half teaspoon of Ceylon cinnamon, which is the recommended variety. Iron facilitates oxygen delivery, which is essential for diabetic tissues, including the kidneys and nerves, whereas manganese is essential for the digestion of carbohydrates. But the procyanidins and polyphenols in this spice are what really make it stand out. These antioxidants shield cells, particularly those in the kidneys, nerves, and eyes, against long-term harm brought on by excessive hyperglycemia. Since preparation is where a lot of mistakes are made, let's now discuss it. Use a little stick or half a teaspoon of organic Ceylon cinnamon powder to produce soaked cinnamon water correctly. Let it sit for 8 to 10 hours in a glass of room temperature water. The strength of the bioactive chemicals is maintained by allowing them to slowly leach out through this cold infusion. Warm the water slightly before drinking. Avoid boiling it. Cinnamaldehyde and other important antioxidants are destroyed by boiling, which lessens their benefits and occasionally even irritates the stomach. This is a common error made by diabetics. They make use of cassia cinnamon, which is less expensive and found in most supermarkets. Cassia contains a lot of coumarin, a substance that can harm the liver if taken frequently in excess. Ceylon cinnamon is always the safer option because of this. Adding honey or sugar is another mistake. This can result in a rebound surge and negate the effect of reducing glucose. It tastes best plain or with a little fresh ginger added for extra anti-inflammatory properties and a soothing scent before bed. 30 to 45 minutes before bedtime, 1 to 50 ml, or around half to 2/3 of a cup is the recommended dosage. This enables it to function gradually throughout the night without affecting the timing of medicine or digestion. Avoid going too far. 1 to 1.5 tablespoons of Ceylon cinnamon every day is the safe upper limit. Higher dosages, particularly when combined with drugs like insulin or metformin, may cause liver strain, headaches, low blood sugar, or dizziness. For diabetics who are experiencing weight gain, fatty liver, or elevated triglycerides, soaking cinnamon water can be very beneficial. It helps maintain blood sugar homeostasis and cardiovascular health by increasing insulin sensitivity and decreasing fat buildup. Additionally, it functions as a natural appetite suppressor, reducing cravings that occur late at night and frequently cause blood sugar surges and disturbed sleep. The advantages extend beyond managing blood sugar levels. The effects of cinnamon on brain health and nerve healing are similarly significant. Neuropathy is frequently seen in diabetics because hyperglycemia damages nerve cells. By promoting blood flow, enhancing oxygenation, and shielding nerve endings from oxidative stress, cinnamon's antioxidants may lessen that damage. The tingling, searing pain that many diabetics experience at night can be avoided by drinking it before bed to help relax muscles and calm agitated nerves. Additionally, cinnamon water helps diabetics' kidneys, which have a tougher time filtering excess sugar and maintaining electrolyte balance. When taken in the right dosages, its modest diuretic impact may assist reduce water retention without putting undue strain on the kidneys. By lowering the load of oxidative waste and reducing vascular inflammation, cinnamon's anti-inflammatory properties may be beneficial for people with high creatinine or early indicators of kidney stress. It has a similarly potent effect on the heart. Cinnamon promotes smoother blood flow in arteries that are frequently hardened or narrowed in people with long-term diabetes by lowering triglycerides, regulating cholesterol, and improving vascular flexibility. More oxygen will reach the heart, brain, and limbs as a result, particularly at night when circulation typically slows. Preventing heart attacks, strokes, and complications from diabetes foot is crucial. Soaked cinnamon water is an extra benefit for people who are trying to control high blood pressure. Its constituents aid in blood vessel relaxation, enhancing circulation and lowering stress. This benefit is most significant right before bed, when blood pressure should naturally decrease. Failure to do so raises the risk of cardiovascular events at night, particularly in older persons with diabetes. Now, just a brief warning. Cinnamon can exacerbate the effects of blood thinners like warfarin. Additionally, you should always speak with your doctor first if you have liver disease, are pregnant, or are taking numerous diabetes drugs. Yes, cinnamon is natural, but that doesn't mean it poses no risks when taken in excess or combined with certain medications. Apple cider vinegar comes in with the audacious promise to push things even further if cinnamon water subtly whispers balance into your veins. When consumed properly before bed, it's acidic, potent, and surprisingly efficient. Are you prepared to learn how this traditional cure might help control your blood sugar levels while you sleep? Let's investigate. 3. Diluted apple cider vinegar. Although it may not be the tastiest beverage you will ever drink before bed, apple cider vinegar can gradually become one of the most effective ways for diabetics to lower blood sugar, lessen insulin resistance, and safeguard the organs that diabetes silently damages. It is not only the acidity of this hazy, golden liquid that makes it so unique, it's the abundance of natural substances such as potassium, acetic acid, polyphenols, and active probiotic enzymes in their unprocessed raw form. Together, these factors directly assist the diabetic body, particularly at night, when hormonal changes and slowed metabolism make it more difficult to maintain blood sugar levels. Acetic acid is the main active ingredient in apple cider vinegar. Additionally, studies reveal that it lessens post-meal glucose rises by delaying the stomach's breakdown of carbs. This helps avoid the blood sugar roller coaster that many diabetics endure overnight by allowing sugars from your meal or late-night snack to reach your bloodstream more gradually. Acetic acid helps muscles react better to insulin, which reduces the amount of insulin your body needs to create if you have insulin resistance. An tremendous victory for lessening the pancreatic strain. Small amounts of potassium, which balance sodium levels, maintain nerve function, and encourage heart rhythm stability, all of which diabetics frequently struggle with as problems worsen, can be found in a tablespoon of raw, unfiltered apple cider vinegar. Additionally, it has trace minerals like calcium, magnesium, and phosphorus, which work synergistically to promote metabolic stability and muscular relaxation, particularly beneficial if you suffer from neuropathy, limb cramps, or nighttime blood pressure increases. Apple cider vinegar's impact on the liver is what makes it unique for diabetics. The backup organ for controlling blood sugar is the liver. It releases glucose at night to keep you energized while you're not eating. However, this release is frequently excessively forceful in diabetics. This excessive glucose dump is suppressed by apple cider vinegar, improving fasting blood sugar levels in the morning. After only a few weeks of regular use, Many users report morning readings dropping by 10 to 20 milligallons per deciliter. The natural bacteria in raw vinegar, particularly the mother type, that hazy sediment at the bottom, provide yet another unnoticed advantage. These beneficial bacteria and living enzymes enhance gut health, which is directly related to insulin signaling and inflammation regulation. Better digestion, a more efficient metabolism, and reduced internal tension are all supported by a healthier gut, all of which are important when attempting to treat diabetes from the ground up. The proper method for preparation is straightforward, but requires great attention to detail. 1 cup, 240 ml of lukewarm water should be mixed with 1 teaspoon to 1 TSP of raw, organic, unfiltered apple cider vinegar. Drink it on an empty stomach half an hour before bed. Always start with just 1 teaspoon of vinegar if you've never used it before, and see how your body responds. Don't take it literally, particularly in diabetics who already have acid reflux or gastroparesis. The high acidity might irritate the esophagus, damage tooth enamel, or disturb the lining of your stomach. Mixing vinegar with juice, honey, or artificial sweeteners to enhance the flavor is one of the most frequent mistakes made by diabetics. By causing intestinal fermentation or supplying extra sugar, this negates the goal. Alternatively, to soften the taste without altering its medicinal qualities, you can add a few slices of fresh cucumber, a little amount of mint, or a pinch of cinnamon powder. Using pasteurized apple cider vinegar, which is clear and shelf-stable but devoid of the probiotic-rich mother, is another error. For the best advantages, only select raw, cloudy, organic brands. Additionally, you should always consult your doctor before combining vinegar with drugs. When taken in large quantities or without food, it may interact with insulin therapy, potassium-sparing diuretics, or diabetes medications. 1 teaspoon dissolved in water once a day, ideally before bed, is the recommended dosage. Avoid taking more than 2 tablespoons daily, as this might aggravate gastrointestinal irritation, induce hypocalcemia and low potassium, and in rare instances, cause bone loss or delayed stomach emptying, especially in those who already have digestive problems related to nerves. If you have burning, bloating, or cramps, cut back on the dosage or take it off for a few days. Additionally, apple cider vinegar helps maintain a healthy cholesterol balance, which is a problem for the majority of diabetics. According to studies, it can help lower triglycerides, HDL, good cholesterol, bad cholesterol, and LDL, all of which lessen the strain on the heart and blood vessels. This is especially crucial at night when your body goes into repair mode and circulation slows down. Stabilized lipids during this period promote long-term recovery and guard against the hidden heart damage that diabetics frequently experience. Additionally, this beverage promotes weight loss, which indirectly enhances insulin function, lessens fatty liver, and decreases inflammation indicators. Late-night cravings, which frequently undermine diabetic control, may be avoided thanks to its mild appetite suppressant effects. The blood sugar balancing properties of apple cider vinegar can help people who have trouble sleeping because of excessive blood sugar or frequent urination by gradually stabilizing their metabolism at night, allowing them to sleep deeper and more deeply. Diluted vinegar may help reduce sugar spillover in urine, soothe bladder inflammation, and encourage deeper sleep by stabilizing nighttime glucose in those who get up frequently to urinate. Additionally, just one tiny drink may subtly soothe those hidden triggers night after night. If your body feels irritated, your sleep is disturbed, or your nerves feel jittery. More broadly, this beverage has an impact on several diabetic bodily systems. The gut, liver, and pancreatic axis, which is frequently out of balance in individuals with high blood sugar, are nurtured, the neurological system is calmed, Oxidative stress is decreased, kidney filtration is supported, and vascular tone is improved. To put it another way, it doesn't only address symptoms, it affects the entire system that causes diabetes. Please remember to like, comment, and subscribe if these drinks for the evening were useful. This will help you remain up to date on more straightforward diabetes management advice. Give this to someone who needs healthy mornings and restful evenings. Additionally, let's manage blood sugar.